Every week I have so many patients asking me if they should consider hair transplantation, but my answer is very different for different people. For most of them, it is a life-changing decision which actually helps in their treating their hair loss. But for a lot of people, it's a complete waste of lakhs of their money, time and energy. Hi, this is Dr. Ravali Yalamanchalli. Today, let me explain you what hair transplantation is and who is the ideal candidate. So most of the individuals, when they start balding, you must have noticed that all the center part of the scalp is gone and the sides remain, or the back side remain. The back side of the hairs are not DHT dependent or not gene dependent. So when we do a hair transplantation surgery, we take the hair follicles from these areas, from the back specifically, which is called the donor side, and place these follicles in the front area where there is hair thinning or hair loss, which is called as the recipient area. When it comes to the different techniques that we use for hair transplantation, there is FUT and FUE. FUT is an outdated method. FUE also has multiple new level robotic and other advancements that we follow. So who is the right candidate for a hair transplantation? If you're someone who's very young, like a 22-year-old, where your hair loss or baldness is rapid, we usually do not suggest doing a transplant right away. Firstly, we try to stabilize the condition with medical management and some other in-clinic procedures, and only when we think the condition is stable, we opt in for a transplantation. The problem is if you directly jump into hair transplantation, since the loss in these other areas is rapid, 5 years down the lane, you might just have these transplanted hairs left and every other hair is gone and it looks very artificial. So the right candidate for a hair transplantation is someone who has a good donor area. Only when you have healthy hair follicles in the donor area, we can successfully perform a hair transplantation. Let's say you do not have healthy hairs in the donor area, ultimately whatever hairs we take it from there and put it in the recipient area will only give compromised results. So the stage of the baldness. The stage of the baldness is very important when you are considering hair transplantation. If you are in an advanced stage, whatever little hairs we take from the donor area might not be able to cover up the entire recipient area. So the right candidates for hair transplantation are anyone between grade 2 and grade 5. So hair transplantation cannot be done for people who are medically unfit, specifically if they have any scalp infections and if they have autoimmune conditions like alopecia areata or progressive scarring alopecias. So let me walk you through the procedure. It is done under local anesthesia. You are awake, you can talk to us, watch something, take breaks. Everything is very simple. First, the donor area is trimmed, the grafts are taken, and then they are implanted into the recipient area. The process here is very artistic. The angle, direction, pattern of these sites is decided by your transplant surgeon to give you a natural result. Finally, once the grafts are implanted, you can go back home and follow a simple post-care routine. So what happens post-procedure? In the first week, you might have a mild forehead swelling, minimal pain, some discomfort. The first week is all about managing those scabs, be it in the donor area or recipient area. Then between week 2 and week 3, these scabs fall off. You have to follow a very basic shampooing routine with a gentle or a baby shampoo. So between months 1 to 3, there is not much happening. You might have some shedding of hairs in these areas. This is when most of the people panic and think that there are no results and start Googling in midnight. After 4 to 5 months, that's when you actually start noticing new hair growth or a baby hair growth, and by at least 6 to 8 months, you can notice that 50% of the hair grows. The peak results are between 12 to 15 months where the full density of the hair grows back. So one of the most important things that a lot of people do not know or nobody has told them that hair transplantation does not stop hair loss. Hair transplantation is only to cover up those gaps in between. Your existing hair follicles are still going through the process of pattern hair loss or miniaturization or baldness. So you have to keep using a Minoxidil and Finasteride combination to maintain these existing hairs. If you do not do that, in the next couple of hairs, these hairs are gone and only the transplanted hairs stay there, which gives a very unnatural appearance. Hair transplantation is a medical grade surgical procedure. Please do not walk into a random place. Please do not get it done because somebody has told you that there's a discount. And please do not opt in for clinics who's doing the procedure for a very less price. And most of the places, it so happens that the person who is doing the transplantation is completely different from the person who has seen you. So please talk to your doctor, please talk to the treating transplant surgeon and address all your concerns before you go ahead and actually do the procedure. If you're considering a hair transplantation, the first step is not booking for a surgery. The first step is proper evaluation with your dermatologist if you are right candidate and what is the right procedure in your scenario. Please share this video with all your friends who are considering hair transplantation and do not know where to begin. If you like this video, subscribe to my channel.